Joining us now is Chella Price, the director for the Wound Care Center at Holzer Health System. Chella, thanks for joining us this evening.
Thank you for having me.
Hey, so can you tell us a little bit about what Wound Care Awareness Week is for?
Absolutely. This week allows us to get the word out to people who do suffer from chronic non-healing wounds. A non-healing wound would be any wound that has not healed after 30 days. So it's very important to be seen as soon as possible for those.
And how many people around the world or in the United States suffer from a chronic non-healing wound?
There's millions of people. For example, you have venous leg ulcers, you can have surgical wounds, trauma wounds, anything like that. One big one is diabetic foot ulcers. We have a lot of diabetics here in the area. Actually, 25% of all diabetics develop a diabetic foot ulcer at some point in their lifetime, and more than half of those will require hospitalization, and 1 in 5 will actually result in an amputation. Oh. So it's very critical, especially for the diabetic patients, to get into the hospital, be seen, and let us take care of those.
So you mentioned diabetics suffer a lot from chronic wounds. Is anyone else really susceptible to a chronic wound?
Absolutely. It can be any age, anyone.
Is there any rhyme or reason to why these people get chronic wounds?
No, it could be venous insufficiency, they've had surgery, the surgery did not heal properly. I mean, anything like that.
And what would you suggest to people in the region how they can stay healthy? How would you suggest that if they have a wound, how can they keep it clean and keep themselves healthy?
They need to see their physician on a regular basis. They need to, especially a diabetic patient, check their feet. They need to call a wound care center immediately if they do notice a wound, a non-healing wound. Let us get them in. The faster they're in, the faster we can treat. At Holzer, we do have a very high success healing rate, and we do heal our patients within usually about 30 days.
And so you suggest people definitely come in and see a doctor and not try to self-medicate, correct?
Correct.
And where can residents go for more information on how to get help from the Holzer Medical Center?
They can actually visit the Holzer website, which is www.holzer.org. They can also contact the Wound Care Center directly. Our Wound Care Center is a physician-driven, and we treat multi-specialty disciplinary approach to the wound healing. We offer advanced evidence wound management to our patients. We can offer state-of-the-art clinical care, and we also offer hyperbaric medicine. We use a variety of clinical treatments. We use skin substitutes, and also, we can put those patients into the hyperbaric, which pushes 100% oxygen into the blood, which allows the wounds to heal a little faster.